I'm good to go. All right. Good evening, ladies and gentlemen. Sorry for coming in a bit behind schedule. We're ready to start now. I'm very pleased to have you around again for a Zoom meeting. Today we'll be looking at the IVF treatment process at the JOJE Abebe Fertility Center. Now, the reason why we have decided to do this is to acquaint our potential patients who have registered and those who will yet register for the Be Fruitful project to get us acquainted with the process that they will be going through as they to achieve their heart desires of becoming proud parents. So basically, before you even start the process, we want to acquaint you with the knowledge that is required so that you know what exactly the process of IVF is. I'm aware that some of you have gone through IVF before, so you probably know a bit of what I'm going to be talking about. But it's basically to bring to our knowledge the process as it's obtains at the JAFC. All right, so we usually will follow standard protocols when we carry out our treatments, all right? We try to ensure that these protocols are individualized to couples' medical needs. What that means is that no two patients have the same protocol. And that is why after we have gone through the initial evaluation, we will look at your individual peculiar case, and then we will determine what will be the best protocol that will best suit you to give us the desired goal. And so we vary the process depending on patient's treatment program. Well, the first stage is actually the registration and the first consultation. And usually what happens is that the patient who wants to access our care, our fertility care, would call the front desk to book an appointment. And the process of getting that appointment established is to have the registration done. Now, this can be done either online or in person. All right, you will call the front desk. They will give you the details as regards the cost of registration and consultation. And once you have made the payment, they will go ahead to give you a registration form to fill. Now, for patients who want to have an online consultation, they will send a form for you to fill, and then you will fill the form and send it back to them, and then they will register you and schedule you for an online consultation. For some patients who will be seen physically, for those who are in Abuja, they can come in person and have both the registration and consultation done at the same time. While the others who would have, first of all, have the registration done and later come in for their consultation. So the consultation that is done is basically, whether it's online or in person, is basically to have your medical history documentation. All right, it's an opportunity for us to know about your journey, your medical history, your gynecological, obstetrics, surgical, medical, social, family history. Please, I forgot to say this. Can we have all our mics muted, please? We have also made considerable input. Can we have our mics muted, please? Thank you. Please, can we have our mics muted?
Who is this person now? Huh?
Please, can we have our mics muted, please? It's causing serious distraction. Thank you.
Please, you can mute all participants from your end.
All right, so sorry for that. Please ensure that all your mics are muted, please. So like I was saying, the first consultation is to get our medical history documented. And then after we have done that, the next step is now the fertility investigation. Usually you will have the scan done on the day you're having your first consultation. Okay. Now, the next step is the fertility investigations. At the JOJE Fertility Center, we have 3 packages for the investigation. You have the basic fertility investigation, you have the standard, and then you have the comprehensive fertility investigation. For the basic fertility investigation, you have the transvaginal scan, blood group genotype serology, and the seminal fluid analysis. While for the standard is the basic plus the hormonal tests. All right, and the hormonal tests are the AMH, FSH, LH, estrogen, thyroid-stimulating hormone, prolactin, progesterone, and then you also will have testosterone and DHEA. For the comprehensive test, you have the basic fertility investigation plus hormonal tests, basically the AMH and the TSH, and then the ancillary investigations as you have on the slide. And the question that some may want to ask is, what determines which test is done? So for a patient who is a self patient, by self I mean that a young woman who is coming and we are going to be stimulating her, the hormonal tests are required to know our ovarian reserve, to know if there's any hormonal imbalance and all of that. So she will have the hormonal test done together with a basic fertility investigation. For patients who are advanced in age, for whom we're doing a program that will involve a third party, that is an egg donation program, they will not require the hormonal test. So for them, the basic fertility investigation is enough. Now, for those, for the comprehensive fertility investigation, we have added the ancillary test, all right? And this is particularly for patients who are advanced in age, who are probably hypertensive and diabetic, whom we want to also run and do some body checks to be sure that they are fit enough to go on with the pregnancy. So the kidney function test, liver function test, blood sugar test are all part of the ancillary investigations that will be done for patients who are coming in. So for this group of patients, they can either be self-patients or patients who are on the third-party program, but who we need to do, we need to be sure that they are fit to carry a pregnancy. All right, so that is why we have these three basic tests. And the reason why we have done this is to be able to provide individualized fertility investigations. And of course, you will know that the cost would vary. So as it has to do with the Be Fruitful project, the basic fertility investigation is covered in the 500,000 that is paid for 2 cycles. All right. Now, if you are doing hormonals, that's for patients who are going to be stimulating and using their eggs, what would happen is that you will need to pay for the hormonal test. Now, for patients who are advanced in age or who are known hypertensive and diabetic and have not done a routine medical checkup for a while and will be required to do this, then you will need to pay for the ancillary investigations. Now, after we are done with the investigations, the next step is the result review. And that it's done after all the investigations have been completed. And this is very important because it's at this time that we look at the results and we also discuss what the treatment options will be.
So
this result review can be done either physically in person or online. All right. So there are patients who probably have coming and they're not able to wait until the results are out, and they have to travel. Particularly for our patients who have very busy schedule and they have probably just one day to come in and do their investigations. There's the option for you to come in, have your investigations done, and then have the results reviewed online. Okay. So like I said, after we have reviewed the results, so now the results will help us to discuss the treatment options. Okay. So based on the couple's medical history and the results of investigations, the various treatment options would be discussed. For example, we have done the results for a patient and we discovered that the ovarian reserve is very, very low. All right, or we discovered that the ovarian reserve is low. That will help us determine what protocol to use in ovarian stimulation. Or if the semen analysis that have been done showed very low motility and count. In that case, that will help us to decide whether we are doing IVF or ICSI. So please, can we mute our mic, please? This will help us to determine what particular program we are doing, if we are doing an IVF or ICSI. Like I said before, ICSI means intra-cytoplasmic sperm injection, for those of us who don't know. And it's a form of ART that is done particularly for patients with very poor sperm motility and count, where the sperm is taken and injected into the egg. Now, this is done to facilitate fertilization. So that is what we'll offer to patients who have those parameters. Okay, so the couples are given the different treatment options. They are also given the success rate that is attached to each option. And then together we will discuss and look at the different options and look at the option that gives us the best chance of success. This is after we have done the investigation. Like I said before, for patients who are going through this Be Fruitful project, particularly for those who are not based in Abuja, we will try. The aim is to, within a 3-day period, go through the investigations, review the results, discuss the option, and possibly have a mock embryo transfer done, so that the time that you will have to come back and stay in Abuja is limited, is reduced. Okay. Of course, the implications of the results are also discussed, and from the results, patients who would be requiring pre-IVF treatment would also be identified. When we say pre-IVF treatment, we mean treatment procedures that are required before the main IVF treatment. For example, if we have done after the test review and we discover that the semen parameters are poor, patients will be encouraged to go on supplements for about 2 to 3 months to help improve sperm quality. Same also for egg quality for patients who, because of age, who are using their eggs. We would recommend that they go on supplements to improve the egg quality. Now, after we have done the scan and we have evaluated the uterus, there are some patients who may require surgical procedures like myomectomy to remove uterine fibroid, if we think that could be a challenge, or patients who would require hysteroscopy if we think that there is adhesions, or we suspect that there are submucous fibroids or endometrial polyps. So these are all pre-IVF treatment that should be done before the main IVF treatment is done. And that is why we stated that from after you have done your tests, you have had your results review, to when the treatment program would start, you have about 3 to 6 months. And the reason for this is to be able to achieve some of these before the treatment commences. Now, after we are done with the treatment, with the result review, and we've discussed the options and have decided, you will be communicated the date for your treatment and when it will be starting. Now, so for the plan for the treatment, so once payments have been made, the treatment IVF team will plan the couples treatment program. Now, this is what we normally do for our regular clients that come in. But specifically for the Be Fruitful project, those who are coming in through the Be Fruitful project, you would have made your initial payment of 500,000, and that is what will allow you to come in for your investigations. Now, after you have done your investigations and we have decided on the treatment program we are going to be carrying out, we will communicate to you the date for your program. We will also communicate to you any pre-IVF treatment that may be required. Like I saw a patient this afternoon, and then we did a scan, and then we did a mock, and we realized that this patient will require the fibroid to be removed before we can proceed. All right. Or the patient who we saw, and then we decided that this patient requires an hysteroscopy to ensure that the womb and the menstrual lining is okay before we go ahead. So all of those things are stated, and then it is communicated to you. We will also communicate the additional costs that would be required. Now, in the initial consultation that we have had with you, we have given an idea as to what might be the additional cost. More details will be given after the result review, and then when we have discussed and agreed on the treatment option we are going to be adopting. So the additional cost will be communicated to you so that you are able to plan adequately. Now, for patients who are not based in Abuja, part of what we will also do before you leave is to give you your medications, and then ensure that you have the consent form signed before you leave. As regards the plan for your program, this is usually done a month before the main program starts. I've talked about the pre-IVF treatment, and like I said before, they will include medications or surgical procedures that may be required before the main IVF treatment commences. It's important to note here that not every patient would require to be on medications or will require surgical procedures before they commence their treatment. Like I said before, based on your results review, we will decide patients who will need to be on some form of treatment before the main program. There are some patients, so what are these pre-treatments? Of course, I've mentioned it: medications to improve egg and sperm quality, surgical procedures. All right, weight loss. There are patients who are overweight or who are obese, who will need to shed some weight before they embark on the IVF program. It's very important because this would definitely help to improve your chances of success. And of course, lifestyle modification. That's modification, please. Sorry about that. And for particularly for the male, if you're taking alcohol, you're smoking, this will be the time for you to stop. All right, because alcohol and smoking, they do affect the sperm count. And of course, engage in stress reducing activities, because stress on its own can also affect the process. I did not mention that also part of what we do during the pre-IVF treatment program is to also ensure that patients who are known hypertensive or who are diabetic, all right, we ensure that there is we have very good control of the hypertension and diabetes before we start the process. Now, for the execution of the treatment plan, after you have received the mail containing the specific program that we'll be doing, and then after you have had the plan sent to you, all right, you will have a plan that will be done and sent to you by the IVF team that will contain a tentative dates, all right, of how your program would run, you will have a call from the IVF team explaining to you what the program is all about and how the program would run. This is important because I know patients have to plan. Some patients may need to take some time off work, particularly for those patients who are not based in Abuja. So like I said before, a month before the main program, we will have that plan drawn out and sent to you via mail. And then you have, you'll be called and it will be explained to you. It will be explained to you. Okay. So typically for most of our programs, we usually will start with the menstrual regulation. What we mean menstrual regulation means that we will give you medications like the pills or Primulot N to try and regulate your cycle to fall into a specific period of time, because we run our programs in batches. All right, so once we have determined the number of patients that we are taking through a specific batch, we will start off the program by giving you medication. Please mute your mic. Now, the choice of what medication we use for the menstrual regulation is determined by whether you are still menstruating regularly or not. For most patients who have stopped menstruating, we will usually use the oral contraceptive pill, while for those who are still having a regular menstruation, we will choose to use the progesterone. It's also important to note that you would be giving an injection for down regulation. Now, this is one phase that virtually all patients will go through. Now, the reason for the down regulation is to take over your body system. So whether you are going through a self-stimulation, I mean, you're going to be stimulated to retrieve your eggs, or you're going to be using an egg donor, you would receive an injection to down-regulate you, meaning to suppress your ovarian function so that we can take over your body system. Now, there are two ways we achieve that. Either we use the agonist or the antagonist protocol. I don't need you to bore yourself with the meaning of this, but just know that there are two kinds of protocol that we use. And depending on what we decide, you either will use the agonist protocol, which can either be long, short, or ultra short, or you use the antagonist protocol, which is usually used for patients who we are stimulating to retrieve their eggs. And that is usually commenced on day 6 of the cycle or the day of stimulation. While the agonist protocol, which could either be long or short or ultra short, is used for patients who we are stimulating to retrieve eggs, or for patients who are using an egg donor. All right. We will usually start the injection on day 21 of the cycle preceding the cycle of treatment. There's usually one, the type we usually use more frequently, particularly for patients who are undergoing the egg donation program, is the docetaxel. You now have the Zoladex or the Lupron. These are depot preparations that are given on your belly, below the belly button, subcutaneously, and it will last for up to 28 days. All right, so you will expect to have that injection given. Okay, and then we can also use the buserelin, which is a short-acting daily injection that is given every day. That we use a lot for patients who are undergoing stimulation. Please mute your mic. From this side. Just a minute, please. I want to mute all mics from this side.
Yes.
Just give me a minute, please. Let me mute the mic.
How many told you who mic? I don't know.
The moment you enter the house and the door is closed, you enjoy the AC, they give anything that wants to do the house. So it means that all the pronouncements that were made by the courts now bind this. And on the basis of that, if I am appeal, if it doesn't affect me anymore, why do you give an appeal? If I am appeal, because that seat has been taken away from him, that was why he's ready to receive court. Now the three courts come out this appeal. And the implication of this appeal is to come out. That appeal has a right. So it cannot be required because they enlist any longer. The wizard appeal and die. And now, if that appeal dies, what happens?
And you do, Mr. Mike, mute your mic. You say, Mr. Mike, mute your mic.
You. Because I never, it's not the place of the Senate to go into the place of who ran the election. Who didn't run the election? They're not the electoral body. The electoral body the judgment of the electoral body has issued a valid certificate of return. The certificate of return issued to the senator of the
Bring me my slide. Okay. Sorry about that. We had to mute everyone from our side here. That took a bit of a time. Okay, so I was talking about down regulation, all right, using the agonist protocol, which is a very common protocol that we use both for self patients. Means when we say self, we mean patients who are using their eggs, whom we are stimulating, and then also for patients who are using an egg donor. All right, and we said that for that particular protocol, it's either we are using the long protocol, the short protocol, or the ultra short. All right, and the down regulation is started on the 21 of the cycle, preceding the cycle of treatment. And the reason why we do this is basically to ensure that we are in control of the patient's cycle. Now, patients who may not require down regulation are those who are stopped menstruating, meaning that their ovaries have stopped functioning. So for such patients, particularly for those patients who are going to be using an egg donor and they have stopped menstruating, their ovaries are no longer functional, they will not need to be down-regulated. Now, the down-regulation is supposed to be up until when patients are given the trigger injection, which is the last injection to bring about the final maturation of the eggs, or for egg donation patients on the day of the insemination, when the egg donor, the eggs are retrieved and then inseminated with the sperm of the spouse. That is when the down regulation would stop, and thereafter gestone will not be given, which is progesterone, to bring about the final preparation of the endometrium for embryo transfer. Of course, for the short protocol of down regulation, it usually started on day 1 or day 3 of the cycle. And usually we'll use buserelin 0.5 milligram. And the last injection again is given on the day of ECG trigger or on the day of insemination for recipient patients. Now the choice whether we use the long protocol or the short protocol depends on the patient's profile. For patients who are young, who have normal ovarian reserve, we would want to use the long protocol or the short protocol. However, for patients who are more advanced in age, above 35, with low ovarian reserve, we want to use the short protocol because we don't want to suppress the ovary for a long period before we start the stimulation. So the choice of whether we're using the short or long protocol depends on the results that we get and the patient's profile. It's very important for us to know that once the patient sees her period, the patient is given an instruction to inform the IVF team. Now, this is the circle in which the treatment program proper would start. We have already done the down regulation, which I've already started in the preceding cycle. And then once the patient sees her period, she's asked to call the nurse that she has seen her period, and then she will now also ask to call the front desk to schedule an appointment. Once the patient has seen her period, she will have to go through a mock embryo transfer and then have a transvaginal scan done. This can be done on day 2 or day 3. All right. Now, the reason why the mock embryo transfer is done is we want to be sure that there will be no issues on the day of the actual transfer. Now, this is usually done in the office, but if we experience difficulty, then the mock embryo transfer will be done in the theater. For patients who are coming in for these Be Fruitful projects, note that the mock embryo transfer will be done during the period of your investigation, result review, and discussion on treatment options. Now, the reason why we do it at that time is so that you don't have to come over to Abuja once your period starts. Once we have your details and we already have ensured that there will be no issues on the day of the actual transfer, you can actually start off the program where you are based, and we will give you directions as to what to do. This will significantly reduce the amount of time that you will have to stay in Abuja. Then once we have done the mock embryo transfer, you would then commence controlled ovarian stimulation or endometrial regeneration. Controlled ovarian stimulation for those who we have to stimulate their ovaries to get eggs, and endometrial regeneration for patients whose womb is being prepared to receive an embryo in an egg donation program. So for recipient patients, the endometrial regeneration will start once the donor have started the stimulation. All right. Now the duration for the controlled ovarian stimulation or endometrial regeneration is usually 12 to 14 days. And this process would end with egg retrieval for self-patient or insemination with donor egg for recipient patients. You will have regular transvaginal scan done during this process. It starts on day 2 or day 3 of your menstrual cycle. Now, the starting dose of gonadotropin is determined by age, your BMI, ovarian reserve, or your previous response. Starting dose, standard dose 150, 225 of gonadotropin. And scans are done on day 2, day 6, day 8, day 10, and day 12 of the cycle to determine follicular growth and development. Now, we determine that the eggs are matured once we have at least 3 of the follicles that measure 17 mm in diameter. All right. Now, you will notice that we have stated on the foundation's website the terms and conditions and the details that for this particular program, we are using a standard dose of 150. And that there are some patients who may need to use more than 150, 225, 300 IU. Now, different patients will have different starting dose, and we have stated here what determines the starting dose. Your age, very important. For patients who are above 35, may need to start with a higher dose. Patients with a higher BMI, patients who are overweight, who are obese, we need to start with a higher dose. Patients who have a low ovarian reserve would have to start with a higher dose, or patients who have had a previous response where they did not respond very well. All right, and we needed to increase the dose of medication. So all of these are what determines if we are stepping up the starting dose, and that will determine the additional cost that will be incurred from the use of gonadotropin. So this is a scan on day 2. This is a scan of a patient that has polycystic ovary. So on that day 2 or day 3 latest, you will have a scan done after you have had your mock embryo transfer. And this scan is what we call the baseline scan. We want to know if you have any cyst. Now, for patients who have a cyst on the day 2 of their stimulation, they will have to have a cyst drained. The cyst will have to be drained before we commence stimulation. Now, injections we use different medications to achieve stimulation. We use the follicle stimulating hormone or the gonadotropin, that is the combined FSH and LH. All right. For the follicle stimulating hormone, whether we either use the highly purified or the recombinant FSH. Duration of stimulation is 10 to 14 days. So you'll be taking injection every day for between 10 and 14 days. I know it's a lot. I know some are like, what? 10, 14 days? Yes, that is the duration usually. All right. Now, patients are placed, are given antibiotics, and then the women are given anti-malaria after they are done with the antibiotics. These are prophylactic antibiotics that are given just in case there's any infection, so that the antibiotics will take care of it. And of course, we give the anti-malaria to clear any malaria parasite, because we anticipate that women are going to be getting pregnant, and we don't want to start treating malaria very early in pregnancy. We want to be able to do without that. So the 2 scan is to exclude ovarian cysts. I've mentioned that. The C scan is to check for response. That is after you have taken your injections for about 4 days. Then the day 8 scan is to monitor the follicular growth. Same for day 10. And the 12 scan is to determine if we have reached the target. Like I said, the target is at least 3 follicles that measure 17 mm. And if by day 12 we have not achieved the target, we can extend the duration for another 1 to 2 days. Once we have achieved that target, the trigger injection is given, the HCG, that is human chorionic gonadotrophin injection is given. 5,000 to 10,000 IU is usually used, and that is given either subcutaneously or intramuscularly. And then 36 hours after the HCG injection is given, the eggs will be retrieved. So this process is a timed process, and that is why the very last injection, the 2 last injections that you will take must be timed, and the nurse will give you a specific time to come or a specific time to take the injection. Please make sure you adhere to those times, because the time you take your HCG injection will determine when we would have the eggs retrieved. Now, this is the picture of a stimulated ovary. This is how it looks. You can compare this to the picture we had before of a patient with PCOS. Now the follicles are all looking very big. Each of these follicles, this black circular structure that you see, each of them contains an egg. And so what we do on the day of oocyte retrieval is to go in there and then retrieve, we drain the follicles and then we collect the eggs. So very quickly, for endometrial regeneration, this is for recipient patients, all right? Like I said before, it will start once the suitable donor have started stimulation. The endometrial regeneration is done to prepare the uterus to receive the embryo. And this usually will start after the withdrawal bleeding, okay? And after you've had the mock embryo transfer. And then endometrial regeneration is achieved with estradiol valerate 2 mg thrice daily for 14 days. So for patients who are on egg donation program, they don't take those daily injections for 14 days. Rather, what they do, they take pills. They take the estradiol, which is meant to prepare their womb to receive the embryos, and this typically will be for 14 days. Again, if we measure and we've not achieved at least 7 mm endometrial thickness, the period will be extended. They will have weekly transvaginal scan done to determine endometrial thickness. What you're doing for patients who are on endometrial regeneration is to determine endometrial thickness. Of course, you also want to be sure that they don't have fluid. Once fluid accumulates in the endometrium during this process, it's bad news, and we would have to cancel that program if we have drained and it still recollects, because once you have endometrial fluid, implantation hardly takes place. Now, oocyte retrieval, like I said, this is done 36 hours after you have taken the trigger injection, the HCG. All right, patients are usually counseled on the preparation for oocyte retrieval. So you'll be given a document that will contain all the do's and don'ts, what you're supposed to do. But suffice to say that it's usually done under anesthesia, general anesthesia. There are some centers that will do it under sedation, all right? But we usually like to do it under anesthesia so that patient doesn't feel any pain at all. Patient comes fasting because it's done under anesthesia. It usually will take between 20 to 40 minutes to achieve this process, and the duration is based on the number of eggs that the number of follicles that the patient has. Some patients have a lot more follicles than others, and that would also reflect in the duration of the retrieval. For patients who are on egg donation program, the donor egg will be retrieved at this stage and then inseminated with the spouse's sperm. Now, as soon as the egg retrieval is done, progesterone injection is started. All right, for the patients. All right. Now, this is the final stage. Patients have for recipient patients, they've been on estradiol, preparing the womb, causing the endometrium to thicken. And once we have collected the eggs, and if we've inseminated with the sperm, the progesterone would start. For self patients, it will start on the day of OCR. For recipient patients, we have a slight modification. We have decided that, based on experience, to start the gestone the next day. And the reason why we have done this is to be very sure that we have had a very good insemination. Because the next day, the embryologist will check for fertilization. And once we've had a good fertilization rate, then the patient would start the gestone injection. Of course, update on the number of eggs retrieved and number fertilized will be communicated to the patient by the embryologist. Now, I want to state here that for patients who are not based in Abuja, you would notice that for those who are on egg donation program, they would have done most of this before they come to Abuja. So they would have been on the estradiol. They would have been going to a good center to have their scans done and send us the report, all right, so that we can advise on whether they should increase the dose of medication or not. Now, for self patients, they would have started their injections and they would have gone to a very good center to have their scans done and send us the report to determine if the dose of injection they are taking would be increased or not. For self-patient, we expect that the 10th scan would be done in Abuja. So the last stage of the injections will be taken in Abuja and the scans will be done. That way, we are able to reduce the amount of time that a patient would spend in Abuja. Now, this is the oocyte retrieval. We've talked about it. You can see the needle that is used to retrieve the eggs. The follicles are sucked, and then the eggs go with the fluid, and then the fluid is handed over to the embryologist who would check for eggs in the lab. Again, that is it. You can see that. You can see that very sharp line. This is the needle, all right, that has entered into one of the follicles. This is done under ultrasound guidance. It's safe. There's no fear of injury to bladder or intestine, all right? Each of these follicles will be drained, all right? Each of them will be drained. Each of these follicle contains eggs. They are all drained, and thereafter the fluid is given to the embryologist who will not check for eggs. Now, after we are done with the oocyte retrieval, the embryologist takes over, and then we check for fertilization the following day, and then we allow the the fertilized egg to culture. At JOJE Abebe Fertility Center, we usually do the 5 transfer. All right. Occasionally we do the 3 transfer, but usually we do the 5 transfer, what we call the blastocyst stage. Now, the reason why we do this is more expensive, but we do it because we believe that it helps us to pick the best embryos to transfer. Our studies have shown that the blastocyst stage do give a better outcome. However, there are some patients who we would opt to do the 3 transfer for, particularly if such patients have very few eggs that were collected, and so we have very few developing embryos. So we don't have much choice than to transfer what we have. Okay, so patient again is prepared for embryo transfer. They are told what to do: no perfume, no deodorant. All right, they're given all of those necessary instructions. Patient is informed of the time for embryo transfer on the morning of the transfer. You will know the date for the transfer, but the time for the transfer will only be communicated on the morning of the transfer. The reason for this is because we do, based on the kind of culture that we do, the embryologist will check how your embryos have done on the morning of transfer, and so communicate to the nurses on those who will be having transfer done. Unfortunately, for those who will not have transfer, they will be asked to see the specialist to counsel them and then give them the necessary counsel. Embryo transfer is usually done under ultrasound guidance. Have some water in your urine, so you'll be asked to take some water before the transfer. It's not a long procedure, except if we experience some difficulty, but most times we don't usually experience difficulty. 10 to 15 minutes is enough to have the transfer done. It's done in the theater. Patient is awake, and usually 2 to 3 embryos are transferred. I usually do ask my patients on the just before we do the transfer, how many babies would you want to carry? And I'm always amazed as to the number that they usually would say. Some will say 3, some will say 4, some will say 5. All right, but usually 2 embryos is good enough. All right, for some particular patients, to increase their chances of achieving conception, we will increase it to 3. For patients who have excess embryos, those embryos are frozen. So this is a picture of embryo transfer that has been done. This is the cannula that has been used. It's a very flexible, soft cannula that is used to transfer the embryo. It's usually a painless procedure done under ultrasound guidance. That is the bladder. This is urine. The bladder with urine gives us a window to be able to see and visualize the uterus very well. This is the uterus. This is the catheter, and these are the embryos that have been transferred. You won't see the embryos physically, but what you see are these echoes, which are usually air. All right, this is what you see. This is what represents the media. This is what represents the transferred embryos are contained here. All right, this is the endometrium. And so once the transfer has been done successfully, the patient is given her medications and all the necessary counsel, and then she's asked, she goes home. All right, the pregnancy test is done 14 days after embryo transfer. For patients outside Abuja, of course, they will be requested to do their transfer, do their pregnancy test, and send us the results. Okay, patients are usually counseled on the outcome. For patients who are in Abuja, I usually take my time. I'm the one who usually would counsel them on the outcome of the result, because this is a very crucial stage, Patients have gone through a very long 4-6 weeks period of treatment, and it all comes down to this very day when the verdict will be given. It's either it shows 2 lines and you're positive, like this, or it shows just 1 line. It's usually very heartbreaking when you have to break the result of a test to a patient that turned out negative. All right, but we would go ahead and counsel the patients. For patients who have positive results, and a lot of them do have it, this commences the end of one phase and the beginning of the next phase. The luteal support phase would start for 6 weeks. That will include the use of further injections, oral medications, and inserts to support the pregnancy. For patients who unfortunately will have a negative result, we will counsel them and then we'll encourage them to continue with the journey. For some patients, we are able to tell what could have been the reason why they had a negative result. For some, we may not be able to tell clearly, but before all of this process starts, we usually would counsel patients on what the prognosis is, and that there are certain factors that improves or reduces your prognosis of having a good outcome. And the truth is that in spite of everything working out very well, the success from IVF is not 100%. The success from human reproduction from 2 super fertile couples going through a natural conception is not 100%. In fact, the chances that a couple that will go through 1 cycle of that would get pregnant in a cycle, in a natural conception, is 25 to 30%. Now, these are couples that are very young, have no challenges at all. All right, but with each cycle, your chances increases. With IVF, that chance has even increased. All right, and so for some patients, they will get pregnant in their 2nd attempt, or some will get pregnant in their 3rd attempt. Now, we are hoping, and that is why we have brought out a 2-cycle program, and we are hoping that 70% of our patients and above will get pregnant from this cycle program that we are offering through the Be Fruitful project. All right, but I want to say here that please, we should have an open mind and look at all the various options and pick options that gives you the best chance of success, because there are certain factors that definitely would determine your chance of success. And one of those factors is age. In subsequent meetings, we shall be discussing the age factor as it affects success at IVF, so that we are properly guided in the options that we pick while we go through this process. All right. Many of us, I trust God that every one of us will have this result. And I believe God that we would be saying congratulations to every one of you who would have gone through this process. And at the end of the day, you would have your bundles of joy. That is my heart desire for every one of you. So thank you very much for listening. And I believe that I've been able to shed light onto the process as it obtains at the JOJE Abebe Fertility Center. At this time, I would like to take questions if there are any. If you have any question, just go to the chat room and just drop the question, and I will quickly answer them. All right. If you don't have any immediate question, we can also drop the questions on our WhatsApp group, and we will attend to it. I look forward to having you start your program and becoming very proud parents. Thank you so much. Okay, so do we have any questions? Okay, so there are some questions. There's a question here. Please, can you repeat that sperm help? I didn't get that. Okay, please, sir, the 500,000, what did it cover? The 500,000 covers 2 cycles of IVF. The details are on the website, all right? We've had 2 Zoom meetings concerning this. I'm sure this particular person probably just registered in the last 1 or 2 weeks. The 500,000 covers 2 cycles of IVF, covers basic fertility investigation, covers your registration and consultation, covers freezing, it covers gonadotropin 150 standard dose. That is what it covers. It covers 2 cycles, which can either be fresh transfer or a frozen transfer. And when will the Be Fruitful program ends? The first phase ends on the 31st of March, and then the second phase would begin on the 1st of April. Like I said before, what I'm not sure of is whether the cost will remain the same. Okay. Okay. Okay, please, is the luteal phase treatment compulsory for patients that are not menstruating again? Yes, the luteal phase is compulsory for everybody who have gone through an IVF program. Because if you don't have the luteal phase, you will lose the pregnancy. You have a miscarriage, so it's compulsory for everyone. Doctor, can someone who has thyroid disorder successfully go through IVF? Yes, but that thyroid disorder must be controlled, must be taken care of. If you're hypothyroid, then you have to be on medication, or if you're hyperthyroid, you have to be on medication to control the thyroid and ensure that you have a normal thyroid function test. If the first cycle fails, when will the second cycle commence? Within 3 to 4 months, latest 4 months. After 4 months and you've not had the second cycle, it expires. Good evening, doctor. Please, how long after registration will a patient be communicated? After you have registered, within 24 hours, you are given a call to acknowledge registration. All right. Now, after that, you would now be scheduled for a consultation. Now, that consultation may take some time, usually about 1 to 2 weeks. Okay. The reason for this is because we have a lot of people who are registered, so we're taking them one by one, in turns. So please, I want to ask that please, you should be patient. We will definitely get across to you. But if you have registered and it was successful, you should have gotten a mail, an automatic mail saying your registration was successful. Please make sure you have that. If you didn't get that, that means your registration was not successful. If you got that, then you should get a call acknowledging the registration and asking you to expect the scheduled consultation. What arrangements are in place as per accommodation to help those of us outside Abuja and cut costs? Well, we are providing accommodation, all right, both within a hospital facility and in hotels that are around us, all right? And if you want to have accommodation provided for you, please, you call when you are scheduling your visit, please ask, and then you would be asked, you would have accommodation reserved for you. It's also important to note that for those who are going to be having accommodation reserved with us and are coming by air, we can also arrange airport pickup for you, to pick you up and then to drop you when you are going. You mentioned that the cost is 500,000 and also stated that depending on your age and the dose of drug used, the cost will increase. Kindly state the range of cost for someone who is 45 years old. Now, for someone who is 45 years old, I would strongly recommend that you don't go on the stimulation, meaning that you don't use your eggs because of the chance of success. All right, I would strongly recommend. But basically, the additional cost will range from 50,000 to 250. But for this age that you have put here, using your own eggs will not give us the desired result. Okay. Does 500,000 cover all the procedure? 500,000 does not cover. What do you mean all the procedure? Please go to the website. All the details are there. What the 500,000 covers and what the additional cost would be. Like we have said before in our previous Zoom meetings, the additional cost depends on what is done. Like what we are doing right now, when we have the consultation, every one of you who are registered will have a consultation. Please, if you have not had yours, just be patient, okay? You will have that consultation to give you an idea as to what the additional cost would be. But after you've had your investigations is when you will have a clearer, you have more details as to what the additional cost would be. What is the success rate between fresh egg transfer and frozen transfer? Now, it depends. For patients who are self-patients, whose progesterone levels are high on the day of HCG trigger, the success rate from a frozen transfer is better than from a fresh transfer for patients who have been stimulated. And that is why there's a lot of centers and there's these studies that have been done that seem to suggest that a freeze-up protocol would give us a better success, meaning that once you've generated the embryos, you will freeze all and then not do a frozen transfer in the next cycle. All right, so there is a lot of advantage when you do a frozen embryo transfer. That is for patients who go through stimulation. For patients who are using an egg donor, there's either no advantage of having a frozen embryo transfer as against the fresh embryo transfer. Doctor, please, how does someone register? Please, you go to the foundation's website, www.jojeabebefoundation.org. On the home page, you would see you follow the link there and you register, and then we will get back to you. So I've answered the question on success rate between fresh egg embryo transfer and frozen embryo, not egg, frozen embryo transfer. All right. It also depends on the quality of embryo that is generated, which is a factor of your age. There are some patients who will do well if a fresh transfer is done, all right, because of the quality of the embryo. But if the embryo is of very good quality, all right, in a self patient, a frozen embryo transfer would give us a better success rate, particularly if the number of follicles that were punctured and the number of eggs that were produced, it's more than 10, for example. Particularly for patients who are polycystic, the recommended protocol is to freeze all embryos and do a frozen transfer. Once you have a lot of eggs retrieved, the chances that the endometrial receptivity has been compromised is very high. So for such patients, a frozen embryo transfer would be advised. Luteal support, does the 500,000 cover it? No, please, it doesn't. Luteal support is after you've gotten pregnant, and that is an additional cost, and the cost is 250,000. Please, doctor, is it a must for a woman of about 49 years to use an egg donor? Is there no hope to try using our eggs? Like I said before, I'm going to be doing a presentation on the age factor as it affects success at IVF. So I will be able to throw more light on this particular question and other questions that is related to this. How about someone with a scary womb, Asherman syndrome? Right. So for someone that has Asherman syndrome, what that means is that you have adhesions inside your womb, all right, that has brought your womb together, kept it together. Before you do your program, you need to have hysteroscopy and isolysis to be able to take care of this challenge. It's only after you have done that, and then a catheter will be placed inside your womb, and then you'll be given medications to ensure that your womb regenerates, and this challenge is solved. Once this challenge is solved, you can go ahead and have your program done. Doctor, can someone pay twice? What do you mean, can someone pay twice? Well, you can, the 500,000 is the first initial payment you would make, and that entitles you to that 2 cycle. Once you have, probably we're asking that if you are done with that 2 cycle and for you not able to achieve conception, if you can come in for another program. Yeah, you can come in for another program, but you know that the waiting time will probably would be more, because there are a lot of people who would have registered and will be going through the program. But if that is the question you're asking, yes, it is possible. Or if you're asking if you can pay twice and have a 4 cycle program, I think this particular person should please private chat me. Oh, can someone pay twice? Or if you can pay in installments? No. For the 500,000, you have to get it and pay at once. Yes, I think that's what it's asking. Can you pay twice? How long will the Be Fruitful project program last? It's designed to last for 5 years, but like I said before, the first phase is ending on the 31st of March, and the second phase will commence immediately on the 1st of April. But regarding the cost, that I cannot tell you whether it will remain the same or not. I think I've answered this question before. How do I register? Go to the website, www.jojeabebefoundation.org and register. Please, do you have surrogacy option? Yes, we do, but not on this particular project. You need to call the office, and then you can come in for a consultation and then to discuss the surrogacy options. Please, after the retrieval of eggs and freezing of the eggs, how many days would it take for transfer to start? So if we retrieve the eggs and then we have generated embryos and we are going to freeze the embryos, transfer will be after 2 to 3 months, because we will need your body to fully recover from the stimulation process. Doctor, does it mean that this presentation is for persons below 45 years of age? No, it's for everyone. Patients who are 50 years can get pregnant. Patients who are 55 can get pregnant. All right? It's for everyone who desires to achieve conception. Okay. So I think we're Doctor, please, is drug inclusive in the 500? Yes, drugs are inclusive, except when you use gonadotropin above the 150 standard dose. All right. Do we have questions from the Facebook platform? No, the process is not. There's a question from the Facebook platform. Seems a painful process. It's not a painful process. The process that is painful is probably when you're taking your injections, all right? And those needles are tiny needles, all right? The process of oocyte retrieval is not painful because it's done under anesthesia. And then the embryo transfer is a painless procedure. So can you extend the date till April? Sure, I just said that the date, it continues, all right? It's just the cost that we're not sure if it will remain the same or not, but we hope that it remains the same. How much is IVF? How much is IVF complete treatment? Well, if you are coming in through the Be Fruitful project, the cost for IVF depends on individuals, all right? No two patients would have the same total cost. Doctor, do you vitrify eggs? We have not started that service yet. How many days will I be in Abuja for treatment? So we're trying to ensure that we reduce the amount of stay. So for patients who are coming in who are on the egg donation program, they probably will spend about 7 to 10 days, all right? While for patients who are on who are being stimulated, all right, who are using their own eggs, they probably will spend up to 2 weeks. Up to 2 weeks, right? So that's the duration. What about those with endometritis? Those with endometritis, we would treat with antibiotics. And that is why we prophylactically give antibiotics anyways to all of our patients, just in case there's any infection. What if I want multiple pregnancy? How many of the donor eggs do I need? Now, the chances that you end up having multiple pregnancies is high. The reason why I say so is because usually we'll transfer 2 to 3 embryos. And if you transfer 2 or 3 embryos and all the embryos go on to implant, then you have multiple pregnancy. All right. Okay, so I think can 50 anyone above 45 get pregnant with their own egg? The chances of getting pregnant with your own egg above 45 is very, 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 very low, very low. I don't want to say it's impossible, all right, but it's very, very low. And remember, it's not just the getting pregnant that is the issue. It's also the risk of having abnormalities with the baby, all right? Down syndrome, all the aneuploidies, all right? They are very high at that stage. I doubt if you would, if it's very, 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 chances are very, very, very low, almost impossible, I just to say. All right. Okay, thank you very much for coming on to, okay, what about sex selection, doctor? Yes, sex selection is a different program. We offer that you will need to call the office and schedule an appointment to discuss that. That is not part of this program. Okay. So thank you very much. I am very grateful for your participation and for the questions you've asked. Like I said before, I look forward to having you come in to start your program. To start your program, and I want to wish every one of you, those who have registered and those who are yet to register, who will watch this presentation. I want to wish every one of you a very successful outcome. I believe that this journey will end in praise and that God's word will be fulfilled. He said, be fruitful, Genesis 1:28, and that is what we believe. And that everyone who will take part, who will start this journey, will end this journey being fruitful. So thank you very much. Have a wonderful night. And then we'll see you again in another 2 weeks. Now we've decided that we're going to make these Zoom meetings every 2 weeks. All right. We'll be posting out what we're going to be talking about. All of this is all geared towards ensuring that our patients are armed with the required knowledge that is needed in preparation for this journey. So thank you very much and have a wonderful night.